Welcome back. Let's get to the latest now in the pandemic. It seems to, at least here in the United States, have shifted to the rearview mirror as those case counts have now fallen to a new low. You can see them there really taking a downward turn. Let's chat about this now with Dr. Taison Bell. He's an assistant professor of medicine in the divisions of infectious disease and pulmonary critical care medicine at the University of Virginia. Dr. Bell, always great to have you here with us. So I guess the question that really remains for me here is if there is a danger right now that we could be taking our foot off the gas, perhaps a little bit too soon, perhaps celebrating a little bit too soon, given where we are in the pandemic, but also knowing that case counts could go on the rise again as we see those vaccination rates falling.
Well, thanks for having me. It sure has been a long year plus, and I don't know about you, but I would love to claim any small victory that we can. So it's certainly really good news that we're at an all-time low since the pandemic started with cases, hospitalizations, and deaths. We just have to keep in mind that it isn't over, and we still have gaps to close. The NBA playoffs are in full swing, so it's kind of like your team is up 2 or 3 games. So you're happy and you want to celebrate that, but you also know that you need to close out the series. So what that means for us is that we have to close the gaps and meet that goal of the Biden administration of 70% of adults vaccinated by July 4th. So we have 12 states now that have met that threshold, states like California, Hawaii, and several states in the East Coast. My home state of Virginia is at 67% and close. And I'm currently in Arizona where that number is 46%. So to close out our series, so to speak, we have to really close these gaps to make sure that we can have a nice summer without another increase in cases like we saw last year.
Yeah, speaking of closing out the season, season's done for the New York Knicks. Very, very tough game to watch last night.
I wasn't going to bring that up.
As I was watching the game, you kind of had to remind yourself that there's a pandemic going on when you saw the cutaway shots to the audience, because it looked like from where I was sitting in my living room like a packed house. Are you concerned that as we continue on into the summer months, more people go maskless? We have no real way of knowing who's vaccinated and who's not, that we could in fact see, another surge here?
That's a really good question. And it really emphasizes the point that a lot of this is local, right? So New York, like in many other states in the Northeast, have done pretty well when it comes to vaccinating. So the CDC guidance that, masks can be off, whether you're outdoors or indoors, if you're fully vaccinated. If you're in an area that has a high rate of vaccination, then you can be relatively assured that you can be in a gathering, a concert, another venue, and be relatively safe. But if you're in an area that has a lower rate of vaccination, that remains a concern. And if you see a lot of people who do not have masks on, and you know that that's a lower rate of vaccination, that could be a potential situation we could have spread.
Okay, so then, Dr. Bell, let's do a little bit of myth busting. For those out there that are vaccinated, even if they are in places where there's potentially a mix of both vaccinated and unvaccinated people, and they are unmasked, can they still contract the virus? Can they then spread that virus to others, perhaps unvaccinated people? And how severe could the virus be for those vaccinated folks that might perhaps get it even after they are fully inoculated?
Well, we know that the vaccination is not 100%. It's very good. It is not perfect. So there's a chance that you could be infected. The chance that would later become you spreading to someone else or you going to the hospital being very sick with COVID-19, extremely low, not zero. So I think the best advice to give people is to use your own gauge of risk level. I think the mask, unfortunately, it has become politicized. And now with the CDC recommendations, there's a lot of confusion. But if the mask gives you that extra sense of security when you're out, even if you're fully vaccinated, I'm all for it. If you have it off at the same time and you want to be around and kind of have that freedom, so to speak, then that's also okay. It's as long as that's okay by your risk profile. So it really should be something that you use to make a decision that makes you feel more empowered.
Dr. Bell, we got news just a short time ago from the White House that they're planning to send 75% of our excess doses of vaccine globally, so to other countries who desperately need the vaccine. I'd imagine that's going to go pretty far in the global fight against the virus, which we've talked many times about the fact that America doesn't live in a bubble and that we need to be vigilant about variants in other parts of the world.
That's very good news. And I think that, the global fight is also our fight because we are increasingly mobile society. And if we see variants or high levels of virus circulating that can lead to variants in other parts of the world, that can make its way back here. And like we've said before, every time the virus multiplies and makes a copy of itself, it's like playing the lottery. And if you have a lot of lottery tickets, meaning a lot of virus circulating, those chances of hitting the jackpot and finding a variant that could either be more transmissible, potentially escape vaccine. Luckily, we haven't seen that so far. That could be a problem all over again and put us back to square one.
And in terms of getting vaccinated, does that all impact the likelihood that we might need to go out there and get boosters if, we see perhaps 80%, if we do get to that herd immunity figure here in the United States, might that actually reduce the need for us to go get booster shots in the future?
It could. Now, the talk about boosters really depends on two things. So one is how long does immunity last to either COVID-19 exposure or to vaccination? How long do you have protection from either antibodies or your other cells that are involved in the immune system? We know that it does go down over time, your antibody levels, but once you get to that point where you could potentially be reinfected, we're not exactly sure when that is. So that's one wild card that's sort of out there. And the other is variants. And so if we can rapidly expand vaccination further, both here and globally, the race against the variants, we could certainly win that. But that would be another potential lever that would have to pull a trigger for us to get booster shots.
All right. Dr. Taison Bell, Assistant Professor of Medicine at the University of Virginia. Always great to have you here with us. Thanks so much.